Diabetes is a prevalent, chronic health condition affecting a significant portion of the global population. Presently, more than 400 million individuals worldwide grapple with diabetes. While diabetes is a complex ailment, maintaining optimal blood sugar levels can substantially mitigate the risk of complications. One effective approach to achieving improved blood sugar levels involves adopting a low-carbohydrate, carb, diet. This article furnishes a comprehensive exploration of very low-carb diets for diabetes management. Understanding diabetes and its connection to diet. In the context of diabetes, the body struggles to process carbohydrates efficiently. Typically, when carbohydrates are consumed, they undergo breakdown into glucose molecules, which subsequently contribute to elevated blood sugar levels. To counteract this rise in blood sugar, the pancreas produces the hormone insulin, enabling glucose to enter cells. For individuals without diabetes, blood sugar levels usually remain within a narrow range throughout the day. However, this regulatory mechanism operates differently for those afflicted with diabetes. This disparity poses a significant concern, as both excessively high and low blood sugar levels can result in severe complications. Diabetes encompasses various types, with type 1 and type 2 diabetes being the most prevalent. These conditions can manifest at any age. In type 1 diabetes, an autoimmune process damages the pancreas's insulin-producing beta cells. Consequently, individuals with this form of diabetes must administer insulin multiple times daily to ensure glucose enters cells and maintains healthy bloodstream levels. In type 2 diabetes, the initial production of insulin by beta cells is adequate, but the body's cells exhibit resistance to its effects, causing blood sugar to remain elevated. To compensate, the pancreas increases insulin production in an attempt to lower blood sugar. Over time, beta cells lose their capacity to produce sufficient insulin. Among the three major macronutrients, protein, carbohydrates, and fats, carbohydrates exert the most pronounced impact on blood sugar management because they are metabolized into glucose. As a result, individuals with diabetes may need substantial doses of insulin, medication, or a combination thereof when they consume substantial carbohydrate quantities. In summary, individuals with diabetes grapple with either an insulin deficiency or resistance to insulin's effects. The consumption of carbohydrates can lead to perilously high blood sugar levels unless appropriate medication is administered. Can very low-carb diets aid in diabetes management? Numerous studies endorse the use of low-carb diets for diabetes treatment. Interestingly, prior to the discovery of insulin in 1921, very low-carb diets were considered the standard treatment for diabetes. Furthermore, low-carb diets demonstrate enduring efficacy when consistently adhered to. One study observed that individuals with type 2 diabetes who followed a low-carb diet for 6 months maintained well-managed diabetes more than 3 years later, provided they adhered to the diet. Similarly, individuals with type 1 diabetes who adhered to a carb-restricted diet experienced significant improvements in blood sugar levels over a 4-year period. In essence, research indicates that individuals with diabetes experience lasting enhancements in blood sugar control when they adopt a low-carb diet. Determining the optimal carb intake for individuals with diabetes. The ideal carbohydrate intake for individuals living with diabetes remains a somewhat contentious issue, even within the community advocating for carb restriction. Several studies have documented significant improvements in blood sugar levels, body weight, and other markers when carbohydrates are limited to 20 grams per day. Dr. Richard K. Bernstein, a type 1 diabetes patient, has maintained excellent blood sugar control in his patients who follow his regimen, which includes a daily carb intake of 30 grams. Nevertheless, alternative research suggests that a more moderate carb restriction, such as 70-90 grams of total carbs or 20% of daily calories from carbs, can also yield favorable results. The optimal carb intake may also vary on an individual basis, given that each person responds uniquely to carbohydrates. According to the American Diabetes Association, ADA, there isn't a universally applicable diet for all individuals with diabetes. Personalized meal plans, tailored to an individual's dietary preferences and metabolic objectives, are the most effective approach. The ADA also recommends collaboration with healthcare professionals to determine the appropriate carb intake for each individual. To ascertain your ideal carb quantity, monitoring blood glucose levels before and 1–2 hours after meals is advisable. As long as your blood sugar remains below 140 mg per deciliter, 8 mmol/L, the threshold at which nerve damage can occur, you can ingest varying carb amounts per meal, ranging from 6 grams to 25 grams, depending on your personal tolerance. Remember that the general principle is that lower carb consumption corresponds to less blood sugar elevation. Furthermore, instead of eliminating all carbs, a healthful low-carb diet should include nutrient-rich, high-fiber carb sources such as vegetables, berries, nuts, and seeds. In summary, carb intake ranging from 20 to 90 grams per day has been demonstrated to effectively improve blood sugar management in individuals with diabetes. However, blood sugar testing before and after meals is essential to pinpoint the precise carb limit for each individual.